welcome back to my channel. My name is Alicia Darlene for those of you that are new. For those of you that watch my videos every week, I just want to say welcome back. It's good to have you. Videos in particular, I do all about my pregnancy journey. I'm not gonna lie, this couple weeks we have been like extremely busy. So if you have been watching my videos every single week trying to get those pregnancy updates, I know I am behind, just because, like I said, we've been crazy busy. Not only am I pregnant, but I also have a 1.5-year-old baby girl, and she is just a wild child right now, so I'm a little bit behind. So this week, like I said, every single week I just would do an update about pregnancy, you know, how baby's changing, how mama's feeling, growing, developing, all that good stuff every single week. But this week I'm going to do something just a little bit different. So I'm actually going to just combine week 24 and 25 into one video. So nothing super drastic changes. If you are watching because you are 24 weeks, then you'll also get 25. And if you're watching because you're 25 weeks, then you'll know previously what the week brought at week 24. Just nothing super crazy. I'm just going to combine those 2 weeks together in this one video. So the last couple of videos, you found out that we were having a baby boy. So we were super excited. We had the ultrasound. We waited for our family members to make us look like a cupcake, and we got to open it together, and we found blue frosting, so we were super stoked about it and just really happy that we now are going to be expecting a baby boy. If you haven't yet watched the gender reveal, it's really cute. You get to see me, my husband, and my little girl Avea just find out when he bites into the cupcake. I think that is at week 22. It'll say gender reveal on it also. So if you want to go check it out, it's at the end of the video. It's just a little clip so you can see that when we found out that we were expecting a baby boy. Like I said, these couple weeks have been super busy for us, so I'm just going to get right into this. I'm starting at week 24 in this video. We'll talk all about baby, mama, and then we'll jump in 25 so you're all caught up. Like always, I always mention that my husband and I are able to stay home. We don't have to send Avea to the daycare, especially with this new baby coming along. We don't have to pay for 2 daycares, so we're both able to stay home and make a full income from home. My husband does a lot of the passive income stuff online, so his tag is passive income lifestyles on YouTube, and his name is Jonathan Montoya. If you want more information about what he does a bunch of courses, online courses to teach you pretty much like affiliate marketing and how to be able to make money from home, because he quit his electrical engineering job and he was able to just stay home with us when we were expecting Avea. So that's super awesome, and I know that it's really important to be able to stay home with your baby, but also to make an income. So if you do want more on that, you can click the first link in the description below. Okay, so let's get into how big baby is at week 24. So at week 24, baby is about the size of the ear of a corn. So pretty big, about 11.5 inches long and about 1.5 pounds. So at this week, I know we're all wondering what our baby's gonna look like, if it's gonna look like us or our partner, or, you know, all that exciting stuff. So if your baby was born at this time or anything like that, you could totally tell who they look like. Of course, they still have a bunch of developing to do, but they already have all those really cool features in their face already, so you could tell who they resemble. So right now, they can't determine the baby's hair color yet. It's kind of just like a white color. I know that's kind of funny. It's like you have this old man baby, you know, white haired baby in your belly right now, but they don't have any pigmentation just yet on their hair. So you'll have to wait a couple more weeks for that. Right now, also, baby is pretty transparent, so just like clearish skin. You can kind of see the veins and stuff through. They don't have pigmentation yet. Just very tender and clear skin right now. So the top of your uterus has risen above your belly button now, and it's about the size of a soccer ball. And if you haven't already started nesting, so nesting is pretty much just when you start going crazy and just like cleaning and organizing everything and getting that space ready for baby. If you haven't done that yet, your nesting instincts are going to start coming in pretty soon. You're just going to start thinking about safety of the baby, where the baby's going to sleep, Like I said, organization. If you have had your baby shower yet, then you probably have already gone through all the clothes, washed them, dried them, and separated them by size. I like to do this. I like to give myself pretty good time for the baby shower ahead of time, so I'm not like super huge when I am like going through all these clothes and organizing and folding. And I like to still be a little bit small, so around like this time. I don't like to be like in the third trimester when I have my baby showers. That's just me, just because I like to have everything like done and put away and ready. When baby comes, I'm not rushing around and getting everything done at the last minute, so nesting will probably kick in within the next couple of weeks. Okay, so let's talk more about mama since we're already into like the nesting stuff. If you're dealing with something like uncomfortable tingling and numbness in your hands and wrists, it's probably carpal tunnel. It's like a pregnancy carpal tunnel. I remember I had it with Avea with my first pregnancy, and I was like, why are my hands going numb when I'm doing my makeup or when I'm laying down in bed? And I brought it up to my doctor, and she said it's pretty normal. It's just carpal tunnel syndrome during your pregnancy. So it pretty much goes away, after I had her, but just during the time my hands would go numb. If I'm sitting there doing my makeup, like I said, I'd have to give my hands a break and kind of just let them unnumb, I guess. But if that's what you're dealing with, you can also talk to your provider about it, but that's just what is pretty common. Also, you can get numbness and tingling in your hands and wrists if you have a lot of swelling going on. So pregnancy causes a bunch of fluid accumulation in your lower extremities, but also in your hands and your wrists. So if you do have a bunch of swelling, just remember to put your feet up when they start to swell and they start to get numb, and just rest and really just listen to your body as the day goes on, so you know that you're taking extra precaution to not keep the swelling going, that you're giving your body rest, because I know that tingling and numbness can be pretty uncomfortable. I had Avea, I had to go through the whole entire summer because I didn't have her till the end of August, so I had the whole entire summer to go through, pregnant, hot. I mean, it was not fun. I remember that I would be super, super hot and I would be wearing, flip-flops or whatever I was wearing, shorts, tank tops, like I could not cool down sometimes. But I remember looking down at my feet and I could not even like recognize my feet because they were just so swollen and huge. So I think it really depends also on the weather and where you live. So just remember that as well. Also, just get prepared to do a glucose screening. You'll probably do the glucose screening between, I think it's like 24 to 28 weeks that you'll have to do that. You'll have to go to like a lab place. I don't know what they're called everywhere, but ours is just like Tricor, and you would just go and get ready to do this screening if you haven't done it already. I think it's best to do the glucose screening fasted. So when you go in first thing in the morning, you go in, you drink this sugary drink. You have to wait 1 hour there. I don't think you can even really leave the facility. And then they will take your blood after 1 hour and just make sure that you are pre-screening you for gestational diabetes. So in my opinion, it was best with her when I did fasted. This time they're telling me that I could eat breakfast as long as it's just like protein and no carb. So we'll see what I decide this week, but it's something to think about. If you could totally do it fasted and you can do it first thing in the morning, that's something that I would recommend, especially if you're not too far from the lab. So just get ready for that. Okay, that's pretty much it for week 24. Let's dive right into week 25. Like I said, I'm combining these 2 weeks just to kind of get things rolling, get me back up to speed because we've been super busy. So week 25. So the baby is about the size of a rutabaga. So if you don't know what that is, I'll post a picture here. So baby is about 13.5 inches long and still about 1.5 pounds. And you are in your 6th month. You only have 15 more weeks to go in week 25. So like I said last week, that your baby's skin is pretty translucent and clear. They're just going to be continuing to develop the baby's skin at this, and then to also just be filling out because baby is pretty wrinkled and kind of skinny right now. So baby's just working on getting more fat deposits in there to help with like temperature control when they arrive. So the baby's lungs are still developing, just getting better, getting more developed. but also the nostrils at this time are getting more developed. So at this week, your baby's actually taking like practice breaths inside. So if you start to feel like a little kind of like hiccuping, just little like murmurs, I don't know exactly how to explain it, but that would probably be like practice breathing that your baby is already doing in your uterus. Okay, so week 25, all about mama. There's some really cool symptoms this week, or I don't know if they're symptoms, but one of them is thicker hair. So you might feel like your hair is longer and thicker and fuller, and it just looks really nice. I feel like this week my hair does look longer. I don't know if that's just because, you know, I read this before and I know that it's supposed to be like this week that your hair looks amazing and great and you're glowing. But that's just what they say that happens this week because of the hormones that are going through you. Instead of your body shedding the hair that you usually do, it's keeping it on, I guess. That's why your hair might look fuller, which I mean, I don't really mind right now because it does look nice, but that's just something that is pretty cool this week that you might be dealing, or not dealing with, but just going through, is just some like fuller, healthier looking hair. So another one is pale skin. If you notice that your skin is looking a little bit pale this week, I would definitely bring it up to your provider because it's a sign of anemia, which is like an iron deficiency. Especially if you're a vegan or vegetarian and you're starting to look pale, I would definitely bring it up because you want to be on top of that. It's pretty common around this time in pregnancy, but your provider might just test you for that just to make sure that you are not. Another fun one that we are or might be dealing with this week is constipation, and then you might be dealing with hemorrhoids. It's just like swollen, itchy veins around your rectum. They do go away, they'll get better, but they will be pretty painful if that's something that you're dealing with. They're not dangerous to your body, but you might have some rectal bleeding. Especially, it kind of goes hand in hand with the constipation. So if you are constipated and you are kind of pushing your bowel movements out, that increases your chance for getting a hemorrhoid because of all the pushing and all the pressure. But I think you can do like ice baths and SIDS and bath, and you can also provide about that because they have a lot of good tips for you if that's something that you're dealing. But remember, that's super common too. Okay, so this week you want to make sure that you are on top of all your dental care. I know it seems kind of like unrelated, or if you think maybe you should skip the dentist until after you have the baby, I would say don't skip your dental appointments. Make sure that you are going and getting checked as often as you would before. Just make sure that you obviously, I mean, we all know this, brush your teeth today and make sure that you're flossing to reduce the risk of gingivitis. So you don't want to have like those red swollen bleeding gums. So they say that untreated gingivitis during pregnancy is called like periodontitis, I believe, and that can link to preeclampsia. And there's also the old wives' tale that it can also lead to premature labor. So I know it sounds like your dental care and all that like wouldn't really affect your pregnancy, and I'll just kind of wait until I have the baby to go get checked up at the dentist, but absolutely do not skip those appointments. Just make sure that you are staying on top of your dental because you don't want it to lead to something that affects your baby, you and your baby. So at this time, you also just want to make sure that you're eating healthy foods. I mean, we talk about that every single week, but if you are craving sweets and stuff like that, like donuts and muffins, just make sure that you are sticking to, like I said, the healthier sweets. So you can do like cottage cheese, you can do fruit, yogurt with like walnuts, dried fruit, tangerines and cinnamon, just like a whole bunch of other stuff, that other options that you can do. I know that when I have certain sweets in the house, I mean, it's hard to resist them when they're right there in front of you. So it's a good idea just to get like those healthy sweets, or even just if you're craving salty, to have those healthy options already ready to go. They're in your pantry or they're in the fridge. If you're gonna do fruit, already have them cut up and like they're ready to go, so you don't have any excuses why to pick the other unhealthy. That's just a little tip, just to have it already ready and cut and ready in the fridge. So that pretty much wraps up these 2 weeks, 24 and 25. Next week, I'll just talk about 26. I'll see how you guys like this video that's combined. You know, maybe it's a little bit better because you get all the information in one video instead of in 2 separate videos. So leave me a comment below to tell me if you like to combine the weeks or if you like to do them just 1 week at a time. I think next week or maybe at week 27, of course I have to look back at my calendar when I am planning on doing, and I'll let you know all about that. So we will see you in the next video. Like I said, please like and subscribe to my channel if you haven't already, and we will see you in the next video.